So it goes to see that even experienced divers can normalize symptoms that are not normal. Equalization difficulties aren't just how you are built or what is wrong. So, what is an eustachian tube? If you see here in the large picture, the eustachian tube is actually like a pressure valve. It connects the middle ear cavity from behind the TM, which is the eardrum, to the space behind your nose and throat. When we yawn, we swallow, or when we do the Valsalva maneuver, this tube will open, allowing the pressure in the middle ear to equalize with your external environment. Now, when this tube is unable to open properly, the air will be trapped in the middle ear cavity. For divers, this would mean slow or difficult equalization, ear discomfort, or even barrel trauma. This can usually be caused by nasal allergies, nasal inflammation, or structural narrowing. For this kind of patients, I usually recommend that it can be easily treated and fixed provided it is recognized early and properly assessed. So the next case is about a patient called Lisa. Lisa is a female free diver in her early 30s and she is very dedicated to training. However, whenever she do a certain descent, she will feel intense pressure in her cheek or in her forehead. Sometimes she might even have a mild nosebleed after diving. She thought that it was just allergies or dryness or even heatiness because you're in the sun all the time, right? But this kept on going for many months and soon she found that it is getting more often and the recovery period between each of these episodes became longer. So she came to see me and after I examined her and did a CT scan, I found out she actually had sinus barrel trauma multiple times. So after I guided her on the management and all, she had improved and now she's back to free diving, safer with a better awareness about her sinus health. Free divers, unfortunately, often will underplay sinus symptoms, but you don't realize that your nose is actually more important than you think. Okay. So sinuses are actually air-filled cavities located in the skull. It is connected to the nasal cavity via very small drainage pathways. When there is nasal allergies, polyps or structural narrowing, it causes the air to be trapped in the sinuses. So these sinuses cannot equalize when we ascend or descend. The trapped air will form a vacuum effect which will pull on the sinus mucosa, causing pain, bleeding and also discomfort. In patients like this, unfortunately what's really tricky is that a lot of patients think that they are equalizing well. They equalize, I can go down, no pain, but actually they are only partially equalizing. The air keeps building up and causing pressure, eventually leading to muffled hearing, hearing loss or even barrel trauma. Okay. The last case is about Jess. Jess is a female dive instructor in her late 30s and she teaches actively. She's in the water about 3 to 4 times a week, teaching or guiding students. Soon after many dives, she started to complain that she had ear itching and discomfort after dive. Nothing very serious, no pain, but just enough to annoy her during surface intervals. So to stay ahead, she decided to visit the pharmacy and she purchased a Neo-Deca eardrop and started to apply it after every dive. She herself told me, "Doctor, it's just like my post-dive regime of rinsing ear. I put the eardrops, it keeps my ear healthy and clean." But she continued doing it for a long time. Soon the itchiness became worse and she developed hearing loss. So when she finally came to me, I examined her and I found that she had developed an ear fungal infection, classic otomycosis. Of course, we treated the ear infection and then we stopped the unnecessary medicated eardrops. Now she's back to teaching with less ear discomfort and better awareness. So frequent unnecessary use of eardrops, especially medicated ones, can disrupt the ear's natural environment. So if you're having repeated ear issues, it's time for a proper ENT check. This is what a healthy ear canal looks like. It has got an intact eardrum. It has a protective earwax. It's slightly acidic and is able to keep moisture at check. This is what an inflamed ear canal with fungal infection looks like, it's quite gross. You can actually see whitish fungal spores in the middle. So a lot unchecked use of this famous neo-deca eardrop. If there's no obvious signs of ear infection and you use this routinely, it will actually disrupt the balance of the ear canal, leading to dryness, irritation, and also promote fungal overgrowth. Fungal infection is very stubborn and very troublesome. As a dive instructor, your ear health is also part of your ear. If you have ear infection, you cannot teach and you cannot dive properly. So please, let's not normalize itchy ears as part of the job. Okay, now let's take a step back and look at what is the common picture among these three patients. The first guy is a scuba diver, experienced. He has trouble equalizing. He rationalized that it's just his ears being slow lah. But turned out he actually had an insertion tube dysfunction. The second is a dedicated free diver. She had face pain and nosebleed after diving. She thought it was just allergies or very popular Asian thing, very itchy. But actually she was suffering from sinus barotrauma. And finally is an active dive instructor who decided to protect her ears by using medicated eardrops every time. And then she eventually developed fungal ear infection. So these three divers are all experienced, dedicated divers. They delayed ENT review because they thought they were doing the right thing, or they thought their symptoms were normal. So they decided to push through lah, and then, but what they didn't realize was, after they see the ENT, their conditions all improved and they became better divers. Okay, now next segment of my talk is targeted at dive instructors, DMs, and all the dive pros in this hall today. You guys are not only just guiding and teaching students, you are also the first person to notice if something is wrong with your students' bodies. So as a dive instructor, you can not only guide them to better long-term dive safety, but also be the frontliner for divers' health and also ENT health. So, I'm so sorry, wrong button. Okay. So after looking at these five, sorry, I think I went into a wrong segment. Please let me take a breath and slow down. Okay, actually my second segment is to explore why these real life divers keep having these kind of problems that I see here. So I want to share the top 5 ENT myths that I often hear from my diver. First myth is that if I can equalize, then I am fine. Actually, if you can still have underlying pressure problems or damage without pain. Next, clarinase means I'm safe to dive. Okay, does everyone know what clarinase is? It is one of the most famous decongestant pills in the market. So decongestants are actually short-term too, but they don't fix the proper problem. And number 3, it's normal to feel pain when diving lah. No, it's not. Pain is a warning sign. It's not a rite of passage. And next, blocked ears after diving are normal. This is actually very common, true, but it is not normal, yeah? It could be a sign of barotrauma or ear infection. And finally, I only need to see an ENT if something is seriously wrong. I'll actually want to argue that it is actually better to see an ENT before the problem becomes worse. Okay, so after we look at these 5 myths, let's flip this around and see what we can actually do correctly. For the first one, equalization should not be painful, equalization should not be hard. In fact, equalization should be smooth and feel almost automatic. If you are struggling at every dive to equalize, then there probably is an underlying ENT issue that we can actually solve. Next, this clarinase thing. Okay, so decongestant pills are a good short-term fix. But if you need to depend on them regularly to dive, then there's probably also some underlying issues. And number 3, it is, I say this many times again, it is not normal to feel pain when you are diving. Pain means the body is giving you a warning sign and you should heed it. Okay, blocked ears after diving are normal. This one, many divers ignore it. Blocked ears, never mind, few days it will go away. Actually, it's a red flag. You shouldn't ignore it because it could mean you're either getting barotrauma or ear infection. And finally, about the ENT, I can only say prevention is better than cure. Enough said. It also saves you from a destroyed dive, a wasted dive trip. Okay, now I go back to the part for the instructor and DM. Okay, so no need to talk too much. I will now tell you what instructors should look for in their students. Okay, so these are a list of things that I think as an instructor you should watch out for and heed it as a red flag sign. Number one, if you have a student who's always struggling to equalize, the slow descent initially, of course, they are not used to it yet, that's fine, but if they keep having to stop and have descending issues, don't just assume that it's a technique issue, there could be underlying ENT problems. Next, students who report muffled ear or ear block after diving could mean they already had a barrel trauma. So you need to watch out for this. Students who sound very congested, nose is blocked half the time, or they're sniffling every time they come for a class, these students are more at risk of developing barrel trauma. Students that come to you taking clarinets and nasal spray and everything before diving or eardrop, that is also something you need to watch out for. And also, particularly students who suddenly abort the dive or say, I don't want to do any session because I feel uncomfortable. There is all warning signs. Okay, oops, sorry. As an instructor, you don't need to diagnose. You just need to take notice. Because as a dive instructor, you are the first one to see what's happening to the student. If you sense something is wrong, an early referral to an ENT could actually prevent long-term problems. As a dive instructor, your recommendation holds weight. Your student trusts you, and you can actually guide them to long-term dive safety and not just one course completion. So I have compiled a list of quick ENT questions that instructor can ask their students. This list is actually very short. You can actually finish talking about it in less than 5 minutes, but talking about it allows the student to open up the door for them to tell you about symptoms or ask you questions. Many divers think their symptoms are normal because no one told them otherwise. Okay, so next. So let's turn, we'll talk about diver students, we'll talk about instructors, we'll talk about red flags. Let's change the focus back to you, the individual diver. So before you go for a long dive trip, you will check your gear, your racks, your mask, your BCD, make sure it's everything in check. But have you checked your ears and sinuses too? They deserve preventive care as well. So I compiled this quick self-ENT checklist that you should do 1 or 2 weeks before your dive trip. So what should you ask about? You want to ask whether you equalize comfortably, with or without effort. Do your ears feel clear after flying or diving? Are you free of nasal congestion or facial pressure? This is very important because if you have congestion, it will limit your ability to equalize, causing issues. Have you had any ear or sinus infection in the past 3 months? Even if the symptoms have started to reduce, there could be still residual inflammation, causing difficulty to equalize and increasing your risk of barrel trauma. And finally, are you diving without relying on decongestant or eardrops? I know taking medication on a dive trip should be a backup plan, but it should not be a baseline for a diver. If you answered no to any one of these, I suggest that you get checked before your dive. So when do you see someone like me, a dive doctor that's an ENT? Okay, so many divers will consider seeing an ENT only if something is seriously wrong. But these are the few scenarios that I think that if you suffer from it, you should consider getting checked. First one is now equalization. If you're doing everything right and you still suffer from slow equalization, difficult equalization, or pain, it means there's an underlying ENT issue. You should get yourself checked. Number 2, facial pain, nosebleed, and everything are classic signs of sinus squeeze. If this happens, you need to get checked. Number 3, okay, if your ears feel blocked or muffled after diving, these are again signs of early barrel trauma or indicate pressure-related dysfunction. And number 4, if you're frequently congested or a chronic sinus issue, chronic sinus issue will cause problem with equalization. And problem with equalization will affect your performance, increasing your risk for barrel trauma and risk. If you have a recent ENT infection or barotrauma, even if the symptoms have already resolved, you should still get checked because residual inflammation will increase your risk of repeated injury during the next time. If you rely on decongestant pills like Clarinase and all, get yourself checked and make sure you're optimized. And finally, if you're investing in diving, be it in going for a course, going for travel, or training students, you want to protect your investment by making sure your cellular health is on point. So finally, I want to give you some simple advice I give to every diver in my clinic. I find myself repeating this very often. They're very simple and I hope it sticks. Number one, pain, pressure, ear block aren't part of diving. They are warnings. Number two, prepare your body like you prepare your gear. Three, Clarinase is not a dive plan. And number four, if something doesn't feel right, don't wait until after the dive to talk about it. It may be too late. You're already injured. And finally, I'm not here to stop you from diving. It's about helping you to dive more safely and comfortably. Okay. So thank you for sticking with me until now. Alright, so I'm very happy to share this information with everyone on the team. What should you do next after learning about what I've said? So this whole weekend, I will be at booth A234 and 236 with the Hospital Assunta team. I will be offering free ear scope examination. There's limited slots, so if you can scan the QR code and book your slots, that would be great. We are also offering basic health screening, so we're checking blood pressure, cholesterol, and glucose. This year, we brought in a state-of-the-art body composition analyzer, so it can give you a very detailed report of your body. And not only that, we also have dietitians and consultants on board to help you get better of your health. Do drop by, take advantage of this opportunity to give some love to your health. As part of my commitment to divers' health, I have curated 2 dive medical screening packages targeted at both scuba divers and free divers. These packages are suitable for divers to check on their sinus, ear, and also lung health. At the moment, it's available at the special promo price for limited time only. Please drop by and take advantage of it. Before I end the talk, I would like to go to the next slide, and yes, I would like to give a big shout out to Mega Labs for sponsoring this lens default cleaning solution. It's something small to help you keep a clearer vision both underwater and also a clearer idea of your health. Now, as I come to the end of my talk, I would like to share with you 4 take-home messages. These take-home messages are simple and I hope that you can remember them even if you cannot remember anything that I said this morning. Number 1, small symptoms can lead to big dive problems. Number 2, ENT health is part of dive fitness. It's not optional, yeah? And number 3, pain, pressure, and blocked ears should not be normalized. 4, finally, you don't need to be unfit to benefit from an ENT check. Thank you very much for your attention so far. I'm now opening the floor to questions if there are any. I would also like to reach out and connect with everyone. Please do follow me on Facebook and IG by scanning these QR codes on the page. Thank you so much.
Okay, there was a session brought to you by Dr. B. Chiu Yin. In the meanwhile, if you have any questions, you can always proceed towards the respective booth here. So, I believe the booth is Assunta, right? Yes, you can proceed to Assunta and get more information from Dr. V as well. Okay, coming up shortly, we're coming up to our panel discussion on free diving, yeah? Our panel discussion on free diving. And we'll be having, before that, a presentation brought to you by Lee Kian Lee. And the topic is called Cave Diving Exploration at Banggai Island, yeah? Right? Lee Kian Lee, advisor, Malaysia Cave Diving Association. And topic and footnote, Cave Diving Exploration at Banggai Island at Indonesia. Well, a technical underwater cave explorer Lee and his team are actively exploring underwater caves and mines, including Sungai Lembing and Kinta Valley in Malaysia. Sungai Lembing mines, once among the deepest mines, tin mines here in the world, reach depths of 700 meters with a 322-kilometer tunnel network. In 2021, his team discovered one of Kinta Valley's deepest mines. The expeditions extend across Malaysia, Indonesia, Bosnia, Laos and Thailand. Uncovering new cave systems and potential dive sites, Lee specializes in cave diving, mapping and 3D laser scanning for cave exploration, yeah? Write a short description. Well, explore the underwater caves of Banggai Island, diving into deep sinkholes and uncovering its hidden wonders. This expedition, we have discovered a new underwater species, and Indonesia's largest sea cave, pending verification here, while also providing insights into the region's unique culture and environment. So, coming up shortly, we'll be having Lee Kian Lee, and the topic for today is called Cave Diving Exploration at Banggai Island. And once again, to bring it out to all visitors, welcome back to the Malaysia International Dive Expo, which is the second day of the show. Okay, please put your hands up and give a warm welcome to Lee Kian Lee. Thank you. I'll give you.
Hello. Good afternoon, everyone. Thank you for MIDE to invite us to give us a chance to present our Bagai exploration in Indonesia last year. So this exploration is not just underwater cave, but also dry cave, lake, and sea. So before we start, I would like to introduce myself. I'm Lee Kian Lee. So my actual profession is a system integrator and digital twin expert in oil and gas industry. So I'm not a geologist, I am not an archaeologist or interested in any history kind of the study before this. But during the journey, I start to learn about geology, about archaeology, and then the history and the history about local community and about the cave, the area. So during the last few years, so we mostly concentrate on the expedition. So I've been joining few international expedition last year. There is Malaysia early this year, we mapped about 10-kilometer cave, and then Laos expedition, and then Bagai expedition. This is what we're going to talk about today, where we possible to find a new species and possible the largest underwater cave in Indonesia.